One of the features of EMS Bootcamp that attendees really benefit from, and Greg and I truly enjoy, is the question and answer section. So, my co-presenter Greg Fries and I decided to give a little behind-the-scenes peek at part of a Q&A session to allow future attendees the chance to see the interactive power of EMS Bootcamp. Let's listen in as Greg fields some questions from myself and Jamie Davis during the career development session.
I had an emailer that's been through several interviews, and on a couple times they've gotten questions that they felt like were offensive or they shouldn't have been asked. It was too personal or just didn't seem appropriate for a job. Like during an interview they were asked, well, you have kids. Do you think that would be a problem to making your scheduled shift? Or, I'm wondering how old you are. And the three of us know that those are questions that really aren't appropriate for an interview, but, what would you advise to somebody when asked that question? How should they respond, or what should they do in that situation?
As the interviewee, you need to respond respectfully and to the degree that you think is appropriate, because obviously I think this person's asking this question because they've been burned in the past and hired somebody that had some family issues that were causing them some problems. The age question shouldn't be an issue at all, but I think if you get asked a question like that, the only real way to answer is to just give them the answer to your age. I don't think there's any way to avoid it. The fact that they ask the question at all it may be an indicator that you want to look elsewhere for a position, just because to me it shows a lack of professionalism on their part. And I'm not sure if you think that's good advice. I'm going to be interested to hear what your response is to that too. But I think to the age question, that's really, you're kind of stuck between a rock and a hard place. I think you just need to go ahead and answer it and not act like it's something that bothers you. The other thing is, when they ask about family concerns and problems, you can just say, well, my family supports me in my job and in what I do, and we work together really well as a team. And then I would turn the question around. I would say, have you had problems with employees in the past in that issue? I would want to know where that comes from, and maybe turn it around on them a little bit and see what their response is. But I would just indicate that your family supports you, that you work together as a team, that is part of your family environment, and that should be all that they need to hear.
I think I would advise similar things, with the age thing, to not dodge it or confront it, but to just answer and then move on. And yeah, I would have that thought in my head of like, okay, that's an inappropriate question. Is this, because you're interviewing the organization to see if it's a fit for thing. And with the question about family, you might say something like what you've suggested, my family's very supportive. And then you might also turn it back and say, I've read on the company website that this is an organization that's very supportive of its employees and tries its best to have a family atmosphere. And, that was one of my questions, is about, how do you can turn it back to ask the interviewer of like, actually one of my questions was, what are some of the ways that this organization supports employees that have a family? Because I know many paramedics entering the workforce have a spouse and have children, and that's something I'm looking for in an employer, is that it's going to create a family-friendly workplace, and you could put it back to them to answer as well. So I have another question for Jim, and Jim, I think somebody was anticipating that we would put some emphasis on, working for a private agency or getting some of that inter-facility type experience if you're just entering the EMS profession. And the question is pretty negative in that, why would I want to do inter-facility transport, work for a private? It's just going to be a lot of old people, a lot of dialysis runs. Why would I want to do this?
Well, I mean, that seems to be a kind of a running theme, I think, with people who kind of look down on the transport side of EMS. Even a lot of 911 providers, when they see the transport people at the hospitals and on the road, they kind of look down at them as being, the glorified type taxi ride. But I think it's important to point out that there is a lot of experience you can gain from being on the transport side. I mean, I've been in contact with some transport paramedics who know a lot more about certain aspects of EMS, like with medications and detailed patient medical histories and drugs that I might have been exposed to. They can get a lot of exposure to that type of, EMS, field, thinking about the patients. You get these elderly patients who have a long list of drugs and medical conditions, and when you're on a transport side, you kind of grasp what to look for and how those patients present. When you get to the 911 side, if you decide to go that way, then when you see these patients in an emergency situation, you can really identify what's going on with these types of patients, a lot quicker than someone who has none of that type of experience. And, also the experience you get with, I think I mentioned ventilators and IV pumps and balloon pumps and all this type of thing that you won't get as a 911 provider. That's usually reserved for the transport, side of it. So I don't agree that it's something that's a waste of time. I think you can get a lot of experience with it, which is why I think a lot of 911 providing agencies kind of require you to have some type of experience before you get into 911. So if you're coming into the field and you don't have any experience at all, they require at least having that transport experience, because you get to take a lot of blood pressures, you get to look at a lot of EKGs, a lot of patient medication, whether it's prescribed or what they might be getting, in the emergency room. So, I don't really agree with that. I don't think it's a waste of time. I think that everyone really should spend some time in the transport side of things. I know I did, and a lot of people that I know, at least did, 6 months to a year on the transport side before they went to the 911 side.
I'd like to jump in too, Greg, and add a few comments to that. Not only do you have the knowledge base of seeing a lot of different pathologies in different patients, but how often in the 911 setting do you get patients that come into your ambulance and you have a full packet of their medical history? This really gives you a unique opportunity to look at and see lots of different EKGs, to see development of different types of diseases, and see patients that give you that experience, as Jim said. But then the second part of that is you also interact with many other aspects of the healthcare community. You're taking patients to a dialysis center. It gives you a unique opportunity to learn about dialysis centers, to make some networking contacts in these various transport settings that a 911 person, they go to the call, they go to the emergency department. They know the nurses and the docs in the emergency department. They don't know anybody else in the hospital. You, as a transport medic, have contacts in every other aspect of the hospital. And when the time comes for you to move on to a different position or maybe look in a different direction in your career at some point down the road, if you have a strong background in transport or you've worked in transport part-time on the side, you know every area of the hospital, all of the nursing homes around, and you know the place that's hiring somebody as a nurse trainee to move into a nursing program, or you've met a physician that would love to have you come and sit in as kind of a quote-unquote ride-along in his office to learn what a physician does. You have opportunities in that setting for networking that you won't get as a street 911 provider.
Well, that was a quick under-the-hood look at an EMS Bootcamp Q&A session. You can actually go and check out this entire session as well as past and upcoming sessions at emsbootcamp.com.